Welcome back. You're watching SA Today here on SABC News. The Free State Department of Health says that it is concerned about the surge in the number of new coronavirus infections in the province. The National Institute for Communicable Diseases reported that there has been an upsurge in cases in the Northwest, the Free State and the Northern Cape. It recommended that there should be increased testing and contact tracing to contain the situation. Let's now talk more on this. To take the discussion further, we're now joined via Zoom by Dr Kgosi Letlape, the President of the Association of Medical Councils of Africa. Dr. Letlape, as always, a great pleasure to see you. Thank you so very much for being with us here on SABC News.
Good afternoon to you and the viewers.
Doctor, we're obviously looking at the situation in India currently, which is raising great concern. Should and can we compare what's happening there at the moment to what potentially could happen here in South Africa? I mean, we've even heard from the KZN Premier a short while ago saying that, people in general seem to have forgotten that we're still in the midst of a pandemic. People have stopped sort of adhering to the COVID-19 protocols and regulations, as is the case, and what led to India being where they are at the moment.
Yeah, the greatest danger we have is complacency. And if we let our guard off, the virus will be on the upsurge and the virus will win again. And that is something that all of us should take personal responsibility for. If we avoid gatherings, we will cap the spread of the infection. Particularly at family level, we need to ensure that the funerals are still small, weddings are still small. But if you're going to be in the company of other people, rather be outdoors, ensure that social distancing is maintained. The non-pharmaceutical methods are still the greatest barrier to the infection winning. Notwithstanding the fact that communities that are vaccinated, once they let their guard off, the numbers can keep rising again.
Yeah. Let's talk about the situation in the Northwest, the Free State and the Northern Cape. What's been, as you observe what's happening there, there's been, of course, a surge in COVID-19 cases. And no doubt during times of, when people are traveling up and down from province to province, that then means that other provinces will then be affected. Let's talk about what's really behind the surge that we're seeing in those particular provinces.
It'll all be a common thread. And the common thread is that people throw caution to the wind.
Yeah.
Those that are symptomatic are no longer isolated. They are coming out in contact with people. There's less use of masks now. Yeah. And that becomes a problem. So when we begin to stop doing the nice measures that have brought us to where we are, people need to remember that we came down from the heights of our second wave in the absence of vaccines because of non-pharmaceutical methods. They should not be taken lightly, and they are key. So vaccines become an addition. But our basic behaviors of ensuring that we don't go to mass gatherings, we avoid crowding, we do physical distancing, we wear our masks all the time, we wash our hands, we sanitize. When symptomatic, we stay home and stay away from others. Those are the key measures. So don't go to huge festivities. As things open up, still use connectivity to connect with the world and stay home and avoid gatherings. That is key to curbing the pandemic.
Yeah. We're also dealing with, of course, the issue of pandemic fatigue. And I wonder what lessons we can learn from, a country like New Zealand, where their president, Jacinda Ardern, has been quite strict in that where there is even one case, the country sort of goes back to do hard lockdowns. And I know in this country people would fight a situation like that. But I wonder, are there lessons that we can perhaps take from New Zealand, who've been really quite good about dealing with this coronavirus? Please unmute, sir. Dr. Letlape, please unmute yourself.
Okay, I don't know what happened. I hadn't touched the dial.
All right, so I hope
this
you.
Thing has a,
yeah, I hope you caught my.
Can you hear me now?
Yes, I can. Did you hear my question? All right, let me repeat the question. My question was, are there lessons that we can take?
No, the line is not great. Can you repeat the question quickly?
Sure. What are the lessons that we can learn from a country like New Zealand, where they've been relatively, as much as you can be good, if I can put it that way, at dealing with the virus. The President, Jacinda Ardern, has kind of been, if there's even one case of COVID-19, has kind of been strict about adherence and locking down if needs be. And I wonder, in this country, we take a lot from other people. In terms of in the country, where if people are saying we don't want lockdown, this is what's it's impacting businesses and so forth. And I realize that we need to take in what businesses are saying, but you've got countries like New Zealand who, regardless of what's being said, they are shutting down when needs be. And I wonder if a government is taking too much of what is being said outside instead of dealing with the fact that we are in a pandemic.
I think it goes to the values of the society, where there's social cohesion and everybody takes other people's lives seriously. The public will then respond positively to what the government does. And they are not waiting to be commanded. Someone just needs to coordinate the public response. The public is ready to protect one another. They haven't apes before the economy. So when it is necessary for them to knuckle down, when they have a case, as you've said, and the authorities say, we're going to shut down for 14 days, you don't have people threatening to go to court. They all knuckle down and help each other. Now, in our country, we have an issue where rights seem to be more important than responsibility. We see it in our general lives. We see it with having crime that goes up, where even when people have committed atrocities, it's their rights suddenly that are important. The issue that they were victims doesn't really matter. So we have a social ethos that needs to be improved if we're going to be able to fight this pandemic. Every time government comes up with a restriction, there'll be some quarter of society that wants to take the issues to court. So we are not united as a nation, and we need to be working on our value systems where we are there for each other, where there is a sense of what is it that unites us as a nation. Because it looks like in South Africa, what unites us is what actually divides us. And we are a divided nation, and all of us want to be here. The economy is important. We need to keep the economy open, but not at the expense of human lives. So that's what New Zealand does quite well. They have 2 or 3 imports. They close their borders to outsiders so that they do not import the virus in. If it has been spread among citizens, they will close down very quickly. But if you look at it, it's also focused close downs. They go to where the problem lies. When there's a small fire, they will close down that area to extinguish the fire. As our Minister of Health said in the beginning, we go to ensure that we attend to the small fires so that we do not have an inferno. And that's what they do well in New Zealand and also in Australia. So when we're talking about all these pockets, when municipalities are worried in the Free State that there's a rise, we should see their worry expressed in action by local lockdowns in those communities so that they keep the spread. You can't say you're worried and all you do is lip service to your worries, but there's no supporting action to show that you are concerned about an upsurge. It's late to respond when the numbers have gone way beyond. The earlier you respond, the better chance you have of curbing it so that it remains a small fire and not an inferno.
All right. Dr. Letlape, it's always a pleasure having you here with us and your insight. Much appreciated. Thank you, sir. All right, that is Dr. Kgosi Letlape, the President of the Association of Medical Councils of Africa. All right, let's take a look at what the weather has in store for us. I'll be back after this break.